Hi Danielle.
Hello.
I'm Dr. Nettleton. It's very nice to meet you.
You as well.
Welcome. I'm going to go ahead and take off my mask because I am fully vaccinated, which means I'm 2 weeks after my final dose of my COVID-19 vaccine.
Okay.
And I'm able now to meet with people who are unvaccinated or who are fully vaccinated indoors.
One question I have is, if I've been vaccinated, why do I have to still wear a mask?
The CDC made the formal recommendation that people who are fully vaccinated, meaning they are 2 weeks out from their final dose of COVID-19 vaccine, actually do not need to wear a mask indoors.
So if I've been vaccinated, will I need a booster shot? And if so, when?
I don't anticipate there being a booster in the year 2021, but as scientists do additional studies, as researchers investigate further, I could see perhaps with more evidence in a future year like 2022, if we learn more about variants, that scientists may wish to have multiple different types of variants within one type of COVID-19 vaccine to act as like a booster. But there is no recommendation for that at this point in time.
If I've been vaccinated, what are the chances of still getting sick with COVID-19?
So what we've learned about all three of the vaccines, the Pfizer, the Moderna, the Johnson & Johnson, these vaccines prevent you from getting severe disease, ending up in the hospital, and dying. These vaccines work.
Is there any risk of infertility after receiving the vaccine?
We also don't have evidence that the COVID-19 vaccines themselves have caused or led to infertility as well. And there's no scientific basis for that concern as well. It's one of those myths you hear about in the news.
Doctor, what are the risks associated with receiving the vaccine?
You can expect to have a sore arm. You can expect to maybe have a headache, feel a little bit run down, have some chills. Those are expected side effects after being vaccinated. There's only really one main reason not to receive the COVID-19 vaccine is if you have a history of severe allergic reaction to any of the ingredients of the vaccine. And that is extremely rare. We list all those ingredients. You can ask for it at the site of your vaccination.
So there was a pause with the Johnson & Johnson vaccine. Should that be any cause for concern?
Well, there were several reasons why the pause happened overall. So scientists and researchers observed as we were doing the surveillance after vaccination that in very rare cases there were these severe blood clots, but they wasn't sure about how strong this association was. So the CDC made the announcement for the pause for a couple reasons. One, they wanted to alert doctors to be aware of this. Traditionally, when doctors treat blood clots, we use, a blood thinning medication. For this type of severe blood clot, we actually do the opposite. We use a different type of medicine. So we wanted to communicate that to doctors first. And then we wanted to give time to scientists to review and dive down in the data a little bit more. And they found that there may be an association, and at that time it was about 7 out of a million for women of reproductive age of that severe blood clot. And after looking at all the information, looking at the individual's risks, the population's risks, the benefits to everyone, the decision was made to continue to use the Johnson & Johnson vaccines for anybody who is eligible for the vaccines, but to make sure that women of reproductive age, and women in general, are aware that there is an extremely small risk of a very severe type of blood clot, and they should be aware of that when opting for the Johnson & Johnson vaccine.
Does the vaccine have the potential to harm an unborn child?
There's no evidence right now to suggest that the vaccine will harm a developing baby. In general, we avoid giving live vaccines in pregnancy. For example, like NMR or the chickenpox vaccines. We don't give those in pregnancy, given there's some theoretical risk to the baby since they live vaccines. But none of the COVID vaccines are live vaccines.
When will children be eligible for the vaccine, and what maybe age and size restrictions might exist?
And all of these vaccines are currently undergoing more clinical trials to evaluate the safety and effectiveness of the vaccine in children who are younger than 18 and younger than the age of 12. So those clinical trials are ongoing, and I anticipate those to have more information in the fall. And then I anticipate those companies to approach the Food and Drug Administration for emergency approval at that time. Right now, there's no change in the dosing for the 12 years and up, but that's a question for the clinical trials to answer.
So if I've been fully vaccinated, am I safe to travel on airplanes, cruise ships, other means?
You can have that sense of reassurance to travel without as much concern about getting COVID and getting COVID-19 severe disease as well. Now, there are some restrictions depending on where you go. So, for example, in the United States, it's still required that you wear masks on public transportation. So you're still going to require to wear masks on airplanes.
So after dealing with the pandemic for over a year now, what would probably be the top 3 things that you would recommend people do to stay healthy?
The time is now to get vaccinated. You know, I hear folks say, well, I'm just going to wait a little bit longer. But the risk has been very high in Kalamazoo County. You know, our rates are definitely coming down to Michigan, but the risk continues. And the sooner you get vaccinated, the sooner you'll be protected, and the sooner you can get back to normal, your family can get back to normal, and we as a community can get back to a sense of normal.
So I'm young, strong, and healthy. Doesn't it make more sense to develop the antibodies naturally rather than get the vaccine?
We don't know how long immunity lasts for when you have a natural infection. And we don't know how robust that protection is either. We do know that the protection after you get the vaccine is very robust. It works very well. Even for those who get COVID-19, I still recommend that they get the COVID-19 vaccine because the vaccine works so well, and I know they will have a much more protection than they would otherwise. Now, I'm young, I'm healthy as well. You know, why did I get the vaccine? I got vaccinated to protect my family. You know, my children, and I have an infant, they're not protected. Even though they're at less risk for severe disease, you know, my infant is a little bit at higher risk. You know, their lungs are still developing. You know, my wife was pregnant during the pandemic. I wanted to protect her as well. And then lastly, I take care of patients in the hospital and in the clinic. I felt my responsibility to protect my patients. I go from room to room. I take care of patients with lowered immune systems. I take care of older folks who I know have severe disease. So I felt a sense of duty to protect my patients. And I also have a sense of citizenship too. You know, I belong to this community. I care about this community. And so I also want to protect my community as well.